Patient information, age 58 years, gender male self-identified, race ethnicity unspecified, site of care is clinic, history, reason for visit, follow-up after an MI, history of present illness, anterolateral MI 3 months ago, treated with percutaneous coronary intervention with stent placements, discharged from the hospital 2 months ago, was enrolled in an outpatient cardiac rehabilitation program with physical activity scheduled every other day, has not engaged in physical activity for the last 1 month because of daytime sleepiness and lack of energy, reports feeling a little down and loss of appetite since his discharge from the hospital. There's no suicidal ideation. Past medical history, he has had a history of hyperlipidemia, hypertension, type 2 DM. Medications include ramipril, aspirin, prasugrel, bisoprolol, spironolactone, metformin, atorvastatin, and dapagliflozin. Allergies, there's no known drug allergy. Psychosocial history, he has smoked 2 packs of cigarettes daily for 22 years, quit 3 months ago. High risk for cancer. Follows the vegetarian diet, used to enjoy gardening, but reports losing interest. Okay. So temperature is 36.7, pulse 87 per minute, respiration is 16 per minute, BP is 125 over 95 meters of mercury. The height is 180 centimeters, weight is 100 kg, and BMI is 31, which is grade 1 obesity. Appearance, sitting in chair, not in acute distress, flat affect. Neck, there's no JVD. Pulmonary, the lungs are clear, cardiac regular, S1 and S2, then there's a grade 2 over 6 systolic normal at the apex. Extremities, there's no peripheral edema. When they did diagnostic studies, they saw that the hematocrit was 40%, which is relatively normal. Hemoglobin is 13, which is borderline normal for a man. White blood cell is 8,000, which is good. A1C is high, but it's not like above like the recommended phase for diabetics. Total cholesterol is 150, which is good. HDL is good. LDL is good. Triglycerides, I think, should be less than 150. Let me just check quickly. Yes, so triglycerides is good as well. Oh, wait, no, triglycerides is good. Perfect. Then D-dimer is 0.4, which is good. BMP is also good. Then ECG shows non-specific ST segment anti-wave changes. Echocardiography is showing mild mitral regurgitation, and then left ventricular ejection fraction is now estimated to 55%. X-ray of the chest shows no abnormalities. And they say which of the following factors in this patient is most indicative of a poor prognosis. Let's see. So since he has a myocardial or cardiac event and has signs of depression as well, that is really, really bad. It carries significant risk of number one, medication non-adherence, and then medication non-adherence, also not participating in physical activity, being indoors all the time. So I think it's the depression. Yeah. So patient meets diagnostic criteria for major depressive episode. Depression post-myocardial infarction is an independent risk factor for subsequent cardiovascular events and doubles the risk of short and long-term all-cause mortality. Poor prognosis is mainly due to reduced adherence to medications and diminished engagement in healthy behaviors, like participating in a cardiac rehabilitation program, for example. All patients with cardiovascular disease should undergo screening for depression, e.g., with screening tools like the PHQ-2 or PHQ-9. Effective treatment for depression with SSRIs and psychotherapy improves prognosis. Wonderful.